So I guess my message for patient communities is to work together as we do HTEI through the PCIG and learn together, share together, cry together, vent and frustrate together. But ultimately, we have to be up for the challenge. We have to strive to know more about HTA, to know more about our patients, to know more about our role as evidence-based advocates, so that we almost make ourselves indispensable in the HTA process. To some extent, we're dispensable at the moment because we're often not giving HTA the answers to the questions that they need. We tell them things that we think they want to hear about our disease.
I would say they need to have perseverance, energy, because it is a lot of effort. It's quite a technical aspect, but I'm convinced that it is worth to do that. So I would say there's a need of education and to promote this involvement in HTA among their community, of education, some training, of advocacy towards the HTA bodies and towards the industry, the pharma industry, and support to the constituents who are keen to participate in HTA value assessments.
The number of submissions that you contribute to an HTA or the quantity of your participation, I really think it comes down to the quality of participation. So even if you're just submitting 1 point of written feedback or just participating on a 1-hour call with the HTA research team, I really think what you're able to provide in terms of your daily lived experience as a patient, that is expert advice that HTA agencies usually don't have access to until they get to speak with you as a patient. And so that's really what we're looking for in engaging with the patient community, is that expert just experience in living with a condition.
Well, some countries do have their own HTA bodies. Some HTA bodies do not still have their patients or citizen involvement in their process. So I encourage patient organization to learn more about it, to capacitate themselves, and to make sure that every step of the way we will go through that direction and make sure that HTA bodies would value our participation in the process.
Yes, that's a really great question, and I'll flip it back and say you don't need to be an expert in HTA. That's not your role. Your role is there to provide your life experience as a patient expert, to allow us to take that as evidence to take it part as a complement in our decision making. So you don't need to be an expert in HTA. You need to be an expert in yourselves and be happy to share that with us.
I think just do it. Step up, and in the words of Cinderella, have courage and be kind. But just get involved, and don't be afraid to ask what you may consider a stupid question. There is no such thing as a stupid question. I ask them all the time, and it's the only way that we can keep growing, keep adding our knowledge, and understand how we can better get involved as the patient community, and to ensure that we are the center and to ensure patient centricity in HTAs, so that the services aren't dictated by other stakeholders, but we have an active participatory role in that.
And I know sometimes we feel helpless around the public health. Either the public or the private can be really hard to navigate, but you have help. Don't try to do it alone. Search for help.
Here, I'm feeling that we are not alone, and we got a lot of supporting, and you know that our people first with difficult, not just health difficult, but with problem with surviving, and that's why it's important to feel that we are not alone in this world.
Keep going, not at the expense of your health, and hopefully sometime soon we'll have more evidence-informed methods from governments, charities, organizations that can make sure that the burden doesn't fall on the individual or small communities of people who feel that there's no other option. Hopefully someday we'll have much more resourcing for this, so that it isn't just people on the side trying to do this in their spare time whilst having families and jobs, but actually it's well-resourced, evidence-informed, and a bit more inclusive, equitable, and enjoyable.
Educate yourself about what it is, educate yourself about how you can bring your perspective into the process, how you can be useful, and how you can change things and bring the patient perspectives into this whole complex world. As soon as you know how to do that, as soon as you're trained, you have facilities and you might even enjoy it actually.
We have to find out all the opportunities that are out there, because they say that we don't participate as patients because we are not interested, and that's not always true. The truth is that we don't know that those opportunities are there, and while other people are taking care of it, we're the main stakeholders, the first people interested. I'm the first person interested in assessing how technology works or doesn't work for me, the end user. So it's important that as individual patients or as associations, we get informed and play our role.
Yeah, look, my message for patient communities is just reach out and ask somebody, because everybody involved in this sector have a caring nature, and actually there's no stupid question. And if there is, I'm probably going to ask a stupid question anyway. So if you're not sure if it's the right question to ask it anyway.
Key thing about HTA is what we're trying to do is determine value, and nobody knows value better than the people who are actually being affected by the condition. The whole of healthcare is there to actually generate well-being for the people who are affected by conditions and for society, and that's what we're trying to do. And the lived experience of people who have actually had conditions, experienced different treatments, is an extremely important part of the HTA process. I think of there being 3 pillars to it. The official, very technical section will be looking at economic things, there's the clinical evidence, but that 3rd pillar is so important of actually what is the experience of people who have had the condition and how that can help us broaden and complement our understanding of what we see in the other types of evidence. Sometimes it actually contradicts it and we think, hang on, we haven't actually got the right evidence here. And in other cases, it confirms it and we see, yep, this is consistent. And so if you're thinking about getting involved, find out more information. There's lots of people there to help you, and hopefully you will find it a worthwhile experience.
But the key thing is never give up. And never be afraid to bang the table for access to medications that you see available overseas that are not available in Australia, because often it's that pressure that can really make the difference.